Hey everyone, it's Ashley. Welcome back to my channel. It's a little different than my usual videos, my usual setup, but I just thought I would do a little video diary of my recent foot surgery I had yesterday. And, just to share with you and let you into my life a little bit more about what I'm going through. And not only, for my wax community friends, but just for anybody out there who is interested in knowing about plantar fascia endoscopic release and endoscopic gastrocnemius release. Those are the two surgeries I had done yesterday. So just a little bit of history about me and my foot. I'm a pretty stubborn person. I have two of the most stubborn parents in the world, and I guess some of that's rubbed off on me in my life. But I love to work and I love to be active, and I have had plantar fasciitis off and on for probably 17 years. And what plantar fasciitis is it is all of us have a band of connective tissue on the bottom of our foot that starts in our Achilles tendon that comes down. Well, let me explain this in a different way. I work in orthopedics, so I'm trying to explain it in an easier to understand manner. So you have your calf muscle, which is called your gastrocnemius. And then in the middle of the gastrocnemius is where your Achilles tendon starts. Your Achilles tendon goes from the mid of the calf down around and connects into the bottom of your foot right near the ankle. That big tendon you can feel in the back of your ankle, that's your Achilles tendon. And that, when it curves down to the bottom of the foot into the actual bottom of the foot, that is your plantar fascia. And that extends out to all five of your toes. It's a white connective tissue. And what happens over years, some people get this, some people don't. Some people are prone to it. I mean, there are some autoimmune, there are some diseases out there that can make you more prone to plantar fasciitis. I am a diabetic. I have been for 8 years. I have autoimmune diabetes. And I don't know if I'm prone to connective tissue diseases. This is my fourth orthopedic surgery in my life. I've had my shoulder in 2012. I just met my husband at the time. I had my shoulder done. I had my knee done 4 years ago. I had carpal tunnel done last year, and now my foot. So back to my foot. I started working in a grocery store when I was 17. It was my very first job. And if I sound a little hoarse, I did have a general anesthesia yesterday, and they do put a tube down your throat to help you breathe, and a little bit of irritation. So I'm a little groggy today. That's normal. But I started working on my feet from 17 on, all throughout. I mean, I went to college and I came in for summer. I worked between a grocery store and a coffee shop. I was a barista. So I was on my feet a lot. And, I know a lot of us, I think it's just human nature. We tend to put our weight, we shift our weight onto one foot or the other. We don't always stand equally balanced. It's my opinion. And I know myself, I always favor the right side. And that is the side that I had surgery on. I'll show you. Don't mind my bedroom because, this is my sanctuary for the next several days. I'm not allowed to do anything but go to the bathroom and, just do some simple hygiene. But this is my boot that I have on my foot here. This is called a walking boot. It's an air cast. You can pump it up. It's hard to see. There's the valve on the side there. It's hard to see because I do have an ACE bandage. You can see through the hole down there, right here. I'm pretty wrapped up down there. But that's my boot that I have on. In the past couple of years, I would say my fasciitis has gotten severely worse. And I've been seeing my surgeon. I have an excellent surgeon. Um, I've been seeing him for almost a year for this, even though I have struggled with this plantar fasciitis off and on for 17 years, like I said. And I'm stubborn. and I should have got help before. And I've went to physical therapy off and on throughout the years, and I've done the stretching at home. I have the stretchy exercise band. You pull the toes towards you. I've been on the stairs. I'm doing a lot that I can at home, but I think I got to a point where my plantar fasciitis was just not responding to conservative methods. Taking Advil, and I'm not one to take pain pills. I do have some issues in my neck. I do have some disc issues in my neck and my lower back, which I have taken tramadol for. But that is the only thing that I've ever taken strength wise, that I would allow myself to take for some of these ailments. But in this situation, I was finding the last 6 months or so, probably actually, no, that's not true. The last year of my life, when I started to see my surgeon in January of this year, and it's November, so 11 months I've been seeing him. And I was limping every single day of my life, limping, and I could only really do one activity a day. So if I stripped the bed, if I did laundry, if I ran the vacuum and doing housework, I would be on the couch writhing in pain just because my foot could not do it anymore. And I was finding myself disgusted, really, that going golfing with my husband, even though I didn't golf this summer. I drive the golf cart and I caddy and I do that type of stuff, but walking from the cart to the hole or from the cart to the tee and just different things like that, I'm finding myself, like, if I was sit for such, and the nature of fasciitis is morning pain. When you get up from a resting position all night, your fascia starts to relax and it shortens. And then when you put your foot down out of bed for the first step of the day, those little micro tears that you have in your fascia would start to heal overnight, and then you rip them open again. It's kind of like, well, my hands, it's dry here in Utah, and it's winter time. My heat has been on for over a month, and everything's just naturally dried out. My hands are very sensitive to that. It's almost like when you get a paper cut or a cut right on your knuckle, on that skin that just never heals. It takes long to heal. It's kind of like that in a nutshell, except over time, scar tissue builds up from trauma and injury and etc. And even though I'm not an athlete, some people are prone to plantar fasciitis and others aren't. But what makes my situation a little bit unique is I have, in both of my calves, I have what's called a tight heel cord or a shortened Achilles tendon. And I was born like that. That's a congenital disorder. And no matter what I did, I can't lengthen that naturally. So that problem coupled in with plantar fasciitis, you can have tight heel cords. And most of the time, those people end up having some sort of ankle problem, ankle pain, plantar fasciitis, peroneal tendon. Those are on the outside of your ankle. Have those types of problems. And I don't know if that contributed to my development of fasciitis or if it's just a coincidence. But my surgeon, he lengthened my gastroc muscle, which helps with more flexion in my ankle. Like I'm finding I'm having pain on the outside of my ankle. I'm having pain at my Achilles tendon down around the back of the ankle. Was having a lot of other symptoms. And the last couple of months on the outside of my foot, I was developing lateral column pain, which is my doctor was very concerned with how much pain I'm just having all over my foot. So I made a decision back in August to have this surgery done. And I wanted to have it done now because it's Thanksgiving week, and I really love my job, and I really don't like being away from work, but I also understand I need to take care of me, and my foot's not getting any better, and my husband was he is taking care of me now, and he was my ride yesterday and my responsible person. And my surgeon called my husband after my surgery and said that my scar tissue in my foot was some of the worst that he has seen. And he is a reconstructive foot surgeon. And even though this is a simple procedure to him, and I mean that man does miracles on what he can fix in a foot. And for him to say that my scar tissue is some of the worst he's ever seen in his career, that pretty much solidified for me that I made the right decision to have this surgery done. And I wasn't nervous. A couple of friends asked me, was I nervous yesterday, and I said, no, not really, because I know it needs to be done. I had that intuition. I had that, feeling that I need to have surgery. And that's why I had the conversation with my doctor back in August about, I had physical therapy, of course, and I went through a series of injections. They do give you steroid injections into the plantar fascia. A lot of people get a series of 3, and sometimes that can help a person out for a year, multiple months, etc. Sometimes people are able to respond to plantar fasciitis with conservative methods. Most people, in fact, that have this condition are able to rectify it through physical therapy, through home exercises, through activity modifications, etc. But mine was just so recalcitrant that I needed some help. So when I had the conversation with him in August, I said, Doctor, I'm limping every day. I'm in pain every day. I can only do one activity a day, and my foot is screaming at me that I have to sit. I'm finding myself wanting to ask you for pain medicine because I'm in pain, and I don't want to become addicted to that at my age, and I don't want to become dependent on it now, because there might become a time in my life that I might need something like that for a larger issue. So he agreed that, my clinical response, the fact that my first injection I got back in January with him was wonderful. It was like I had a new foot. And when I told him, I said, I should have let you do this a long time ago, because I feel like I have a brand new foot. I was like, man, this is an answer. So then I got so much success from my first injection, I went on to have a second and a third. However, the second injection didn't give me as much relief as the first one did. The first one, I went back 2 months later after my first injection, and I was having great pain relief. So he said, let's give you a second one to see if we can extend this out. They usually give it in series of 3s. I think I said that. And I had the second one, and it didn't, I bit my lip. It didn't give me as much relief as the first one did. But I knew it was important to have this series of injections, because then that would have him make the decision, and me, we as the patient, we are the most important piece of our health, and our most important piece of our health decisions that we make, along with our medical staff. So I was able to ask questions. I was able to see how is my body responding to this injection. And even though it's not curing the problem, it's giving me some immediate pain relief. So I went for my last injection probably, I think I had it in June. And it gave me maybe a week, a good day. A day I had really good relief, but then day 2, day 3, etc. After that, it was like I didn't have anything done. So my surgeon told me that people who get good response from injections, even if it's one of the injections, that they have a beautiful response, then they typically do well with a surgical release. So I wanted to give my foot, I wanted to give it time, even though it's had years, I still wanted to. Surgery's a big deal. Anytime you go under anesthesia, it's a lot of stress on the body. You go through a recovery period, you have to take medicines, you have to alter your life. But I knew it was something that is going to only add to my quality of life. So Um, in August, when the decision for surgery was made, I told him I would have it done now, but I was going out of town for a couple of weeks in October. You know, you all know that if you watch my channel. And I didn't want to put a damper and be in a boot on my trip because I have to be in this boot for a month. I have to sleep in this boot for at least 2 weeks, and I can't walk or put pressure on my foot until Thursday, so day 4. You count your surgery day, and then today's day 2, and then tomorrow's 3, and Thursday, Thanksgiving, is 4. I can start to put weight on my foot as tolerated. And then I don't go back and see him for 2 weeks post-op. It used to be 1 week, but this is not, I don't have pins in my foot. They wasn't doing any bone work, any tendon work to where he needs to, monitor the healing process a little closely. I did have my gastrocnemius, my calf muscle lengthening done arthroscopically. So on both sides of my calf, I have little couple centimeter incisions where, the scope, the camera goes in and he does what he did in the mid. I'll show you on my other leg here. It's about right here in this region. A little scope, a little incision is made here. The camera's put in. Then on the other side, just directly on the other side of here is where the camera comes out. And then down in my foot, right around this region here, is where the fascia starts here and it goes down here and it spreads out like this. But right here is where most people have their pain. It's where the fascia attaches to your calcaneus, which is your heel bone. And that's where mine was like someone was taking a spear or a hot poker and just stabbing me in my heel every single day. Every single day. And it was getting very taxing on me, and I limped everywhere I went. It was just, it was getting very hard. So I had the surgery done. And yesterday when I got there, I was talking, to the anesthesiologist. They come in and they consult you and they do all that stuff. And I was telling him, my nerves are setting in now because I know that you're about to put me to sleep. And anytime you go under, it's a little bit stressful. And I wasn't worried for the actual procedure. I mean, I have an excellent surgeon. He's well sought after. He's very, very, very busy. And I'm not worried about his hands and his techniques. It's the going under the anesthesia where I was a little nervous. But, when I had my hand done, my carpal tunnel release done, I had the same anesthesiologist, and I had such a great experience with him last time. And when he walked in, I said, "Oh, I'm so happy that you're here. I know I've had you before." And he smiled and he sat down, and then he looks at your chart and asks questions, and tells you what cocktail you're going to have and what you're going to do. And I had something called a popliteal nerve block, which in the back part of the knee, back here, actually, back part of the leg here, you have your sciatic nerve that goes down, and it splits or bifurcates right behind your knee, which is called the popliteal area. And then that nerve he was trying to isolate and give a nerve block to, which was only given for extended postoperative pain relief. I haven't taken one of my pain pills yet, and I'm still less than 24 hours out from surgery, but my complete knee down to my toes is numb still. And I'm finding I have a little bit more sensation. You've seen me look down at my toes because I'm trying to wiggle my toes, and I can see my toes are starting to be able to wiggle a little bit. So I know the sensation is probably going to come back, in the next 12 hours or so. It's just my guess. So when that wears off, I'm very, very thankful I was given that, because I would, be a little bit more, I wouldn't be making a video now talking about my experience. But I'm I will do a follow-up video, once I am able to put weight on it later this week. I'll try to give an update because, as a patient, I've watched my surgery on YouTube. But I work in healthcare. I love that stuff. I mean, I sit and I have watched orthopedic procedures on YouTube just to learn and to be able to understand, oh, that's what they're talking about. That's what they're doing. That's what that means, kind of a thing. And I have watched people talk about their recovery with this surgery, their apprehension going into it, their experience day 1, day 2, day 3, etc. And I thought about, I do a diary because I know this is a surgery that a lot of people are nervous about, because I mean, it does have its risks, but I had them done arthroscopically. You can have arthroscopically versus open. Open is when they actually open up the skin and, dissect it down to where they need to work and actually do it with their hands. Whereas a scope is a little tiny, several centimeter incision and the camera is put in and they do it with instruments. That's the difference. So my doctor did both of these procedures through a scope for me, which adds in less recovery time, less post-operative pain, less complications. So I'm very grateful that he has the know-how and the expertise to do that for me. But I just wanted to give a little update on my surgery. I will be back to wax as soon as I'm able to be a little bit more mobile. Poppy is over there napping. I have The Crown on pause on Netflix. I'm trying to get caught up so I can start the new season of The Crown. But I have so much stuff to watch on TV. I've been waiting until I've had this surgery because I know I won't be able to be doing anything. And I frankly don't know if I'm going to be going to Thanksgiving. The last thing I feel like doing right now is getting into the tub because it's, getting up and going to the bathroom. I have my walker here next to me. I have my walker. And they gave me crutches, which I probably shouldn't even taken because I don't know if I'm going to be using them. But, I have them just in case. My surgeon told my husband that being that it's some of the worst scar tissue he has seen, it's possible in the future I might have to have a second procedure done just to make sure that everything is corrected to the best of his ability. So let's hope, fingers crossed, that I don't have to have a second procedure down the road. But if I do, it's only for the best and for because I'm only 38 and I have a life ahead of me, I hope, and I want to have the best quality of life. So I'm going to continue watching The Crown, and I have Nurse Poppy over here providing snuggles. And I'll be back to wax as soon as I can. I have my fall empties basket, which if I'm feeling good in a few days, I might film that later this week or this weekend. We'll see. I can't sit down on the ground until I'm going to have this boot on for a while, and so I probably will have to film in my office, which is okay. I've done it before, but I just wanted to check in and give you an update on my surgery. And thanks for watching, and I'll give an update on my surgery soon. Bye.